Okay? So let's do the review of the basics first. So now I'm gonna show the demo's body. So I have here a massage therapy guide, right? Gonna be sending this to you at the end. Everything that you need from, interview, assessment, range of motion, gait, everything that you need will be here, including a checklist of how to perform specific techniques. And all of these are from the resources provided in the Prometric Handbook. Everything will be there. So let's start with the basics first. This includes draping as well. So some students said they had blankets. Some students says that they didn't have blankets. For the sake of this demo, I will be providing it with blankets. Okay? And then you can, and my suggestion is practice with both. Okay? So first is obviously for the back drape. You don't have to if you have a blanket, don't just flung it open because you can use it just in case. So just, So I'm gonna put myself as the candidate. Okay? Is it okay if I tuck your sheet under your underwear?
Yeah.
Then tuck it in, open, and then get the hand out, get the bottom sheet, use the dorsal side of your hand, and then tuck it quickly. Right?
Yep.
Then you can go on the other side again, because again, safe and effective treatment, okay? You can see it here. I removed the hand, got the bottom sheet, pulled it, used the ulnar side of my hand, and then pulled it forward.
Okay, yeah.
And then, you feel okay? You feel secure?
Yeah.
Perfect. So you see the question that I was using? It's basically simple. Nothing conversational, right? So let's review also the principles of massage. They're not gonna give you a oil bolster there or like an oil bag or something. So you can put it on the safest place possible. Avoid the floor because you can trip in it, hazard, right? So let's start with effleurage. For effleurage, the gist is that it's towards the heart. So instead of starting from the top, start from the bottom. And again, the purpose of effleurage is just to spread oil. Literally just spread oil. Okay?
Yep.
So that's effleurage. If we follow the principle, what happens is this is general because I'm covering the full back. Right? And then I'm gonna go specific, meaning to say I'm only gonna go on the right side. But now because I'm on the right side, it means that I'm doing general. So now let me cut it off a little bit. So now I'm only gonna focus on the upper back. So now it's general, specific, general. You got it? Okay.
Yep.
So the next principle of massage that they want to see is also proximal, distal, proximal. The common misconception is that proximal is towards the head. No, that's not the right thing. Because proximal meaning it's towards the trunk, not towards the head. So meaning to say, you have to massage first whatever is closer to the trunk before you go here. Okay, so if I'm gonna do the proximal, distal, proximal, I'm gonna start proximal, distal, then just do it regularly. I literally just put my hand on proximal and then just spread the oil and then do whatever you feel is best. You got it? Okay. So, and then you can start treating this and then this. Okay? Then we have superficial, deep superficial. Meaning to say, you have to treat the structures superficially first before you go deep. You can also use that in techniques. Instead of using deeper techniques right away, maybe you can start with lighter one first. So how does that work? Okay? So for example, if you're using something flat, like your palm or your wrist, right? Or this part of the knuckle per se, all of those are flat. So every time you use that, even your ulnar border, the pressure is gonna be lighter. If you start using something sharp, like the end of your knuckles here, or your fingertips, or your elbows per se, it's gonna go deeper. So if I'm gonna do superficial, deep superficial on a technique perspective, here's how I'm gonna do it. So first, I will use superficial. So I'm gonna ask the the demo what he feels, right? So do you feel that this is light enough? Yes. So now I'm gonna change it to a little flatter surface. Is it a bit deeper now?
Yeah.
So I'm using my knuckles, right? Now I'm gonna change it to the sharp part of my knuckles. Is it deeper?
Yeah.
Yes. Okay? Sorry. So if I change it to my ulnar border, is it deeper than the other one, the one before this?
No.
No, because it's flatter. The surface is flat. But if I use the elbow, do you feel it's deeper?
Yeah.
You see the difference? So just play around with it. Make sure that the pressure you provide is obviously superficial to deep. Then deep to superficial. Okay? And then the last one would be peripheral, center, peripheral. So for example, for ringing, instead of doing ringing like this from center down, you have to go peripheral, center, peripheral.
Okay.
Peripheral, center, peripheral. Let's say it's manual lymphatic drainage. So we're trying to do it here. Instead of doing the drainage outwards, do it peripheral, center, then peripheral. So going towards the middle rather than going out. Okay? Well, that's my interpretation of it. Most of it will be applied like that. You got it?
Yeah.
That's the principles of massage. And for treatment station, this is a requirement. Okay? Lastly, how to do a quick warm-up using that. My suggestion is pick a couple of techniques and then just do it around 2 to 3 times. So for example, this is my generic warm-up for the back. Right? I'm gonna do Elfarage. Then I'm gonna do palmar stripping. Then I'm gonna change it to knuckle stripping. And then I'm gonna use my thumb to find the problem. Or maybe my fingertips. Oh, I found here a hyperirritable spot, blah, 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 blah. And then after the technique, I'm gonna flush. And then I'm gonna go back to where I started. You see the difference?
Yep.
It's very quick, 3 times. So what I did is 3 times effleurage. 3 times effleurage on the specific area. Then I did palmar stripping, knuckle stripping, or you can even do knuckle kneading and then use your fingertip stripping to find problems.
Yep.
And then do what you need to do with it. Yeah?
Yep.
So for the techniques, the general Swedish techniques, let's go over it.
Yep.
Remember the difference of stripping and kneading. Stripping is one straight line, right? So this one, I'm using my palm to push on the right side, right? So that's palmar stripping. If I'm using my fingertips here, I'm gonna try to increase it so that you see it. If I'm doing this one, this is fingertip stripping. If I use my thumbs, it's gonna be thumb stripping. If I use my ulnar border, it's ulnar border stripping. If I use my elbow, it's elbow stripping. If I use my knuckles, it's knuckle stripping. Because the point is, stripping should be unidirectional.
Yep.
Yeah? Unidirectional.
Yep.
Then,
Got it.
when kneading is circular. So if I'm gonna go here, and I use my thumbs in circular motions like this one, this will be considered as thumb kneading. If I use my fingertips, this will be fingertip kneading. If I'm gonna use my knuckles, it's gonna be knuckle kneading. Right? If I'm gonna use my palm, it's gonna be palmar kneading. If I use my my ulnar border, it's gonna be ulnar border kneading because it's circular. If it's elbow, which is a bit hard to do, then it's elbow kneading. Okay? Other things that it's under that is the ringing. So for ringing, you grab it from the end and then from the center. So from peripheral, center, peripheral. Peripheral, center, peripheral. Right? So it's like grabbing tissue from the side, going in and then stretching it out. Then you also have, what's this? This is C scooping. This is better for the arms. So let's do it in the arms, let's say. C scooping.
C scooping.
Right? You can also do skin rolling. It's a bit hard because I'm gonna just remove the oil on that one. Skin rolling is also a facial technique, and it's also a GSM technique, so you can do it in both. So skin rolling, you grab a tissue, then just roll it, right? Grab a tissue and just roll it. Again, grab a tissue and roll it. It's a bit hard for him here. It's usually good on the lower back, but for video purposes, gonna do it from this way. Okay? Okay? What else is in that? The tapotements. For the tapotements, remember, not really advisable here. A little bit above would be good. So let's start with the lighter ones. This one would be tapping. Right? This would be tapping. Then we have the pincement, where you're trying to like pick up little pieces of something, whatever you think about it. And then we would have light hacking. Light hacking would usually be using these parts of your hand, but very light. Very light. Light hacking, if you use both of the arms now, then it's gonna be heavy hacking. Okay, so light hacking, if it's only this part of your hand that you're using. If it's both, it's heavy. You're gonna feel it anyway. And then you're gonna have the cupping. Difference is cupping because your hands are on a cupped motion. And then, or clapping. Difference is cupping is cupped, right? Cupping is cupped. And then clapping is flat, like you're patting them.
Okay.
Then we have beating. You're using this side of your hand, right? And then some people have pounding, which they use this side of the hand, like you're pounding on the door. Okay?
Yep.
So those would be the general Swedish techniques. And again, for Swedish techniques, they are used not just to treat areas, but to also ensure that you have a transition between heavy techniques like trigger points. Because it's weird that you're just doing trigger points here and then moving along, right? So your general Swedish techniques would be a good transition point to move around. So your massage has rhythm, your massage has movement, and it's not just stale in there.